Welcome to Damal Consult Career Academy. Are you preparing for a care manager interview in 2025? In today's video, I'll walk you through the most common care manager interview questions and, more importantly, how to answer them effectively. Whether you're applying for a role in a care home, NHS setting, or private healthcare, this guide will help you stand out and succeed. So grab a pen and paper. Let's get you fully prepared. 1. Can you describe your experience in managing a care team or facility? Yes, I have over 5 years of experience managing care teams, primarily within residential care settings. In my most recent role as a senior care coordinator at Sunrise Senior Living in Surrey, I was responsible for leading a team of 20 care assistants and support staff. My responsibilities included organizing staff rotas, conducting regular supervision and performance reviews, supporting ongoing training and development, and ensuring compliance with CQC standards and safeguarding protocols. I was actively involved in care assessments and planning, working closely with residents, their families, and multidisciplinary teams to ensure each care plan was tailored to individual needs and preferences. I also conducted regular audits and quality checks to monitor and improve the standard of care provided. One of my key achievements was implementing a new staff mentoring program that improved team morale and reduced staff turnover by 30% within the first year. I strongly believe that effective communication, ongoing support, and leading by example are essential for managing a successful care team and delivering high-quality, person-centered care. 2. How do you ensure high-quality care is consistently delivered to service users? To ensure high-quality care, I focus on a combination of staff training, clear communication, and regular monitoring. First, I make sure that all team members are properly trained and understand current best practices, including person-centered care and safeguarding protocols. I hold regular team meetings to discuss care standards, address concerns, and reinforce expectations. I also carry out routine audits and spot checks to assess the quality of care being delivered and identify areas for improvement. Feedback from service users and their families is crucial, so I encourage open communication and use their input to make adjustments when needed. By fostering a culture of accountability, continuous learning, and compassion, I ensure that care is consistently safe, effective, and respectful. 3. How do you handle conflicts between staff members or between staff and patients? I believe that effective communication, active listening, and early intervention are key to resolving conflicts. When a conflict arises between staff members, I invite the individuals involved for a private, respectful discussion where each party can share their perspective. I remain neutral, encourage open dialogue, and focus on finding a common ground or compromise that maintains a positive working relationship. If the conflict is between a staff member and a patient, I first ensure the patient's concerns are heard and addressed sensitively while also supporting the staff member. I review the situation objectively and take appropriate action, which may involve additional training, reassignment, or mediation if necessary. My goal is always to maintain a respectful and safe environment for both staff and service users while promoting teamwork and accountability. Before we proceed further in this video, if you're preparing for a care manager interview, you don't want to miss this. I've put together an exclusive ebook titled 50 Care Manager Interview Questions and Answers designed to help you prepare, practice, and pass your interview with confidence. It's very affordable, and right now, it's available at a 70% discount. Get it today for 70% off. For this week only, the first 20 people to download will get the ebook at an exclusive 70% discount. To download your copy, just click on the Sealer or Fourth Wall link in the description box below. You can order directly through Sealer Co. or by clicking the Fourth Wall link, whichever is easier for you. Need more information? Chat with our online customer care representative via WhatsApp or email us. Don't miss this opportunity to get your copy today and ace your care manager interview. Now, let's get back to the video. 4. What steps do you take to ensure compliance with care, regulations, and policies? To ensure compliance with care, regulations, and policies, I take a proactive and systematic approach. First, I stay updated with current legislation and guidelines, such as those from the CQC and relevant local authorities. I regularly review our internal policies to make sure they align with the latest standards. I also conduct regular audits and risk assessments to identify any areas for improvement. Training is crucial, so I ensure all staff receive up-to-date training on safeguarding, health and safety, and best care practices. I hold regular team meetings to reinforce expectations and encourage open communication, so staff feel confident reporting issues or concerns. Finally, I document all procedures and updates clearly, so there's a transparent record of compliance efforts. This structured approach helps maintain a high standard of care and keeps the organization inspection ready at all times. 5. How do you manage and allocate budgets within a care setting? As a care manager, effective budget management is essential to delivering high-quality care while ensuring financial sustainability. I begin by conducting a thorough assessment of the care setting's needs, including staffing levels, training requirements, medical equipment, daily operational costs, and contingency planning. I set priorities based on regulatory requirements and resident or patient needs. I work closely with finance and senior management teams to develop and monitor budgets, using historical data and forecasting to allocate resources efficiently. I implement cost control measures, track expenditures through monthly reviews, and adjust allocations when necessary to respond to changing circumstances such as unexpected medical needs or staffing shortages. Transparency is a key part of my budgeting process. I maintain detailed financial records and ensure that all department heads understand their financial responsibilities. Ultimately, my goal is to balance cost effectiveness with the highest standards of care, ensuring every pound spent contributes directly to the well-being of our service users. 6. Describe a time you had to deal with a difficult family member or service user. How did you handle it? In my previous role as a care manager, I encountered a situation where a family member was very distressed and frustrated about the care plan for their elderly relative. They felt the plan wasn't adequately addressing certain needs and were worried about the quality of care being provided. I understood how important it was to validate their feelings, so I started by actively listening to their concerns without interruption, ensuring they felt heard and respected. I expressed empathy by acknowledging their worries and the emotional toll this situation was having on them. After understanding their perspective, I calmly explained the rationale behind the current care plan, detailing how it was designed to meet the client's specific needs and promote their independence and well-being. I also shared information about any assessments and consultations that informed the plan, to help them understand the decision-making process. To foster collaboration and transparency, I arranged a meeting with the care team and the family member. This allowed us to openly discuss their concerns, review the care plan together, and explore possible adjustments that could be made without compromising care quality. By involving the family in this process, I was able to build trust, reduce tensions, and create a more supportive environment for the service user. Ultimately, this experience reinforced for me the importance of clear communication, empathy, and partnership when managing difficult situations with families. It also strengthened my skills in conflict resolution and collaborative care planning. 7. What strategies do you use to lead, motivate, and support your care team? As a care manager, I believe that effective leadership is built on clear communication, mutual respect, and creating a positive work environment. To lead, motivate, and support my care team, use several key strategies. First, I set clear expectations and goals for the team, ensuring everyone understands their roles and how their work contributes to the overall care of service users. This clarity helps create a sense of purpose and direction. Second, I prioritize open and honest communication. I hold regular team meetings and one-on-one check-ins to listen to any concerns, provide feedback, and celebrate achievements. This helps build trust and encourages team members to share ideas and challenges freely. Third, I focus on recognizing and appreciating the hard work of the team. Whether through verbal praise, written acknowledgments, or small rewards, I make sure to acknowledge individual and team contributions, which boosts morale and motivation. Fourth, I encourage professional development by supporting training opportunities and career growth. This shows my commitment to their success and helps the team feel valued and invested in. Lastly, by example, demanding reliability, empathy, and a strong work ethic, I strive to create a supportive environment where team members feel empowered, respected, and confident in their abilities to provide high-quality care. Together, these strategies help me build a motivated, cohesive care team focused on delivering excellent service to our clients. 8. How do you stay updated with changes in health and social care legislation? To stay updated with changes in health and social care legislation, I make it a priority to regularly engage with a variety of reliable sources. I subscribe to newsletters and updates from official organizations such as the Department of Health and Social Care and the Care Quality Commission, which provide timely information on new policies, regulations, and best practices. I also participate in professional forums and online communities, where health and social care professionals discuss recent developments and share insights. Additionally, I attend relevant training sessions, workshops, and webinars that focus on legislative changes and how they impact care delivery. Keeping up with industry journals and publications helps me deepen my understanding of emerging trends and legal requirements. By actively seeking out this information and integrating it into my daily practice, I ensure that my care management approach remains compliant, up to date, and aligned with current standards, ultimately improving the quality of care for the people I support. 9. What would you do if you suspected abuse or neglect in your care setting? If I suspected abuse or neglect in my care setting, my first priority would be to ensure the immediate safety and well-being of the service user. I would carefully observe and document any signs or evidence that raise my concern, including physical indicators, behavioral changes, or any other relevant information. It's important to remain objective and factual in my documentation to support any necessary investigations. Next, I would follow the organization's safeguarding policies and procedures strictly. This includes reporting my concerns immediately to the designated safeguarding lead or appropriate authority within the organization, such as a manager or safeguarding officer. I understand that timely reporting is crucial to protect the vulnerable person and to trigger an appropriate response. I would also ensure confidentiality is maintained throughout the process, sharing information only with those who need to know in order to act. Additionally, I would provide support to the service user, making sure they feel safe and heard, and work collaboratively with multidisciplinary teams and external agencies as required. Overall, my approach is to act swiftly, responsibly, and compassionately, always prioritizing the protection and dignity of the service user while adhering to legal and ethical safeguarding frameworks. 10. Why do you want to work as a care manager with our organization? I want to work as a care manager with your organization because I deeply admire your commitment to providing person-centered, high-quality care that truly improves the lives of service users. Your reputation for innovation and dedication to continuous improvement aligns perfectly with my professional values and aspirations. I believe that working here will allow me to contribute my skills in care coordination, leadership, and communication to a team that genuinely prioritizes holistic and compassionate care. Additionally, I'm impressed by your organization's focus on staff development and training, which shows you invest in your team's growth and well-being. This is important to me because I am always eager to learn and develop my skills to better serve clients and support my colleagues. I am passionate about making a meaningful difference in people's lives, especially in helping vulnerable individuals maintain their independence and dignity. I believe that this role with your organization will give me the opportunity to make a real impact, while working with a supportive and professional team committed to excellence in care management. Do you have any question for us? Yes, thank you for asking. I do have a few questions. Could you please tell me more about the team I would be working with and the key challenges currently facing the care management department? Also, how does the organization support ongoing professional development for care managers? Finally, what are the next steps in the interview process? Thank you for watching. I hope you found these care manager interview questions and answers helpful as you prepare for your big day. If you did, please give this video a thumbs up, share it with others who may benefit, and don't forget to subscribe to Damal Consult Career Academy for more expert interview tips and career guidance. Got questions or need help with a specific interview? Drop a comment below. I'd love to help. Good luck with your interview. You've got this.